osteopath or osteomed practice of osteopathy. The following exercise is to be done under the recommendation of your healthcare practitioner and/or trainer. If the exercise gives you any problems or aggravates any problems you already have, or if any good pain turns to bad pain, then stop immediately and contact your healthcare practitioner. So, today I'm going to show you 3 exercises, 2 stretches, one for the flexors of the forearm, one of the extensors of the forearm, and a soft tissue release. These are extremely good for pretty much any pain problems that you have from the elbow down, whether it's the fingers, the wrist, or the elbow itself. So such things like golfer's elbow, tennis elbow, carpal tunnel syndrome, even if you have pain, discomfort from arthritis or something like that, it can be good. It is also very good for any post-activity self-care, self-management that you might need to do. So after sports and activities such as tennis or biking or basketball, basically anything where you're using your upper limb. It's also very good at the end of the day or during the day if you're working a lot on the computer with a mouse, painting, literally anything. So if you think I'm using my upper limb for something, then you can use it. The first stretch I'm going to do is for the flexors of the hand and fingers, wrist and fingers. Remember, when you're doing a stretch, you're trying to bring 2 points further apart. You're trying to get between those layers of tissue, trying to lengthen it basically. So basically the muscles, you have to remember that do the flexion of the fingers and of the wrist, most of them anyway, attach up here. The flexors on this point, the extensors on this point. So, as we said, you're trying to bring 2 points to get further apart, not together. So you want to be aware to keep those fingers flat, because if they are actually flexed like this, then when you do the stretch, it's not going to be as effective. So to do that, I'm going to stretch the left side. I'm going to take the other hand and go over the top, fixing the fingers and the thumb at the same time. Don't leave out the thumb. Many people leave it out. So you want to fix all of them at the same time and straighten them and really keep them straight in that way. Actually, if you already feel a pull or a stretch into the wrist or somewhere when you do this, like I actually am now, this can be enough. You can start that 3-point rule in this position. If you can go further, then you are going to bring the elbow, basically extend the elbow, straighten the elbow until you start neutral actually. You would, pretty much every stretch or soft tissue release that you do, you want to start at a neutral point and then go into the stretch. By that, in this case, you mean increasing the stretch. So fingers down, straighten the elbow, have it low down, and also following your nose, you want it over the midline. So not in the middle, not on the same side, but over the midline. Just a little bit, it doesn't have to be much. And then to increase the stretch, you want to bring the arm up. And as soon as you feel a pull, like with all of the stretches, it doesn't matter where, you might feel it in the fingers, you might feel it in the wrist, you might feel it here, you might feel all of it. But wherever you feel it, that's enough. So for me, actually, like I said, I could already feel it here, but I can go further. So I'm going to hold that position, wait for it to relax, increase, wait for it to relax, increase, wait for it to relax. Again, that 3-point rule. And to increase, in this case, you bring the arm up. You can play with it a little bit by bringing the hand out a little bit or in a little bit to see where it increases that stretch, makes it more specific to that flexor area, or in the wrist, both. So that's for the flexors. For the extensors, we're going to do exactly the same technique, but the opposite direction, meaning the exact same positions. So the flexors are here. Again, you want to have in this case, we want the fingers a bit more flexed because we're bringing the extensors further apart, the ones that do this. So we're going to, almost like a fist or a claw, we're going to hold that position. And then flex that wrist, bringing that hand down. Bring over the hand, straighten the arm basically. Again, you can twist the hand, left, right, inside, outwards, outside. I'm losing my words today. And play with it to where you feel it a bit more specific. And as all of them, remember when you feel that point. Maybe it's in the wrist, maybe it's up here, maybe it's both. So you hold that position, wait for it to relax, increase, wait for it to relax, increase, wait for it to relax. Actually, there's a variation on this as well that when you're a bit more flexible, you can do. I don't advise it. If this is enough, don't try and do this next one. The variation when you're a bit more flexible, like I have funny elbows, so it's going to look a bit strange when I do this. But you can actually do it in this seated position. And for the flexors, I mean. And in this case, you would put your hand, again, you're going to have the hands completely flat. I'm going to come back so you can see it. You're going to flatten those fingers completely on the chair or on the sofa, whatever it is. Flatten them completely and then do the stretch in this way. And then you can turn the elbow inwards, outwards, whichever you find feeling more specific here or here. Sometimes I find that this does a bit better the forearm, and like this a bit better the wrist. You can play with it and see. So those are the two stretches and the variation on one of the stretches. And next I'm going to show you the soft tissue release. So for this, again, any hand problems, wrist problems, forearm tension, you can do this technique. And with the soft tissue release, again, I do that 3-point rule, finding the tension. Basically, all of this you can do as a release. You can do it as a soft tissue release. And what I tend to do is very easy on a table. You can do it on your lap as well, but it's easier on a table or something. You get the other elbow, then you go into that tissue. What you want to do when finding the correct spot, if you can of course, is you can either go to the painful points, like poke your thumb in and find a painful point, or poke your thumb in and find a bit more hard points. It should be soft, actually, the tissue. And then a combination of that, so painful and hard. If you can't, or you're not quite aware of how to find those points, it's actually okay. You can do the whole area, but it's much more efficient if you follow those points. You won't have to do it as much, basically. You can test it as well, so you can also flex against the resistance, that wrist, and then feel into this where you need to do it. Get the other elbow, find one of those points, push into it. When you do this, you'll see maybe that your fingers or wrists tend to flex like this. If that's the case, then you want to keep them flat, because in this case you don't want to bring 2 points further apart. And then you go deep into that, within that pain barrier, of course. Wait for it to relax, increase, wait for it to relax, and then go to the next point. You can do this whole area down here, the whole area down here, and the back as well. For the back, you might find it's quite painful at these attachment points about the elbow, so be a bit more careful. And again, you can go all the way down this line. If you're having problems with the thumb, You can actually follow the line of the thumb from this, what we call the anatomical snuff box. You can see there's this little hole. If I extend my thumb, you can follow that up and find some of those thumb extensors and work into that as well, doing that soft tissue release. The other one that you can do too is for the hands. So most of the muscles, as I said, that do these movements are here, but you have this fleshy portion here and here, the thenar and the hypothenar eminence they're called, and you can work into that. For this, you don't need, you can be a bit more dynamic with movement as you do the soft tissue. You might be able to feel this little like bubbles in there, and basically that's a sign that there are some adhesions in those tissue layers, and you pretty much want to get rid of them. So you can work all the way up here in different lines and all the way through here in different lines. You can do the same actually around the wrist as well. Always with these techniques, especially if you're having wrist pain, you want to be a bit more careful within that pain barrier. Good pain is good, bad pain is bad. Okay, that's all for today. Thank you for watching. I've been Emma from Osteomed Practice of Osteopathy.